Are you wondering what fascia is? Maybe you've heard about fascial release and wondering if that would be helpful for you. Or maybe one of your friends said, maybe you have a fascial problem and you're just never heard of it before and you're wondering what is going on with fascia, what it is, and how it might be affecting you and your pain. Then today's video is for you. Today we're going to be discussing what fascia is, how it can impact you, and what you need to do if you think that you have a fascial problem. So fascia is literally everywhere in our body. It literally goes from the tip of our toes to the top of our head. It not only covers all the tissues in our body, so it covers the muscles and the tendons and the nerves and the blood vessels and all of that stuff, because it goes right underneath. You have the skin, you have the subcutaneous fat, and then you have the fascia. It's kind of like the saran wrap of the body that holds everything together, but it doesn't necessarily all run in a straight line. So you do have some fascia that runs all the way up your leg, but then you have thick pieces of fascia that run from, let's say, your right hip up to your left shoulder. So it runs in all kinds of different patterns. It's kind of like a spider web in your body, but it literally covers every single part of your body. The other thing that fascia does is it actually forms slings that hold your organs in place. So if you've ever wondered, why don't my organs run around my entire abdominal cavity? It's because fascia is holding them in place. But the fascia can get tight, and then that can prohibit the organs from being able to, quote unquote, move. Obviously, your organs do not transport around your body. That's not what I'm trying to say. But they do need to be able to breathe or contract and relax, if you will, in order to do their function. And if the fascia around them, that sling, is very tight, it makes it difficult for that organ to move correctly, which can make it hard for it to move correctly. Now, if you have ever heard of your iliotibial band, that is a band that runs from your hip down to your knee, and that iliotibial band is a very thick piece of fascia. If you've ever felt like yours is tight and you were told to foam roll it or that you should stretch it, you know it's very, very difficult to stretch, because fascia is this very fibrous type of thing. I like to compare it to a shrinky-dink, if you know what a shrinky-dink is. But they were these plastic pieces that you would color, and then you would put them in the oven, and then they would shrink up. That's a shrinky-dink. And that's how the fascia is too. So when you heat it up, you can stretch it sometimes, kind of like taffy. When it gets warm, you can stretch it a little bit. But it can also be like a shrinky-dink in that it can shorten. So you can get areas of tethering in your body where that fascia is just really tethered down to the tissues that are underneath it. So normally the muscles and bones. And it can get tethered down there, and then it just doesn't move correctly the way it's supposed to. Think about it like when you have a scar in your skin and that area around that scar gets really tight and it's difficult for that part of the skin to move. Well, that's what fascia can do, except for it's down deep and underneath everything else. Now, just to make it a little bit more complicated, we also have fascia that goes around the muscle fibers. So you'll have groups of 5 to 10 fibers. They'll be sheathed in fascia. And then you'll have multiple sheaths. So again, 5 to 10 sheaths together. They'll be sheathed in fascia together. So you have fascia inside your muscles, you have fascia surrounding your muscles and your joints and your ligaments and your tendons, and you also have fascial slings that are holding your organs in place or keeping them where they're supposed to be in your abdominal cavity, as well as the fact that you'll have thickened areas of fascia that have special names. So particularly the plantar fascia or the iliotibial band that we've discussed before. So yes, if you suffer with plantar fasciitis, this is what we're talking about today. We are talking about the fascia, a thickened piece of fascia that's on the bottom of your foot. That's the plantar fascia. The thickened piece of fascia on the outside of your leg, going from your thigh to your knee, that's the iliotibial band. Again, we do have really thick pieces of fascia that go from one hip to the opposite shoulder. So this can cause a lot of problems if you have like a shoulder problem and then you start to notice you have a hip problem on the opposite side. That's probably due to that fascial sheath, as well as the fact that you literally have fascia right underneath your skin and subcutaneous fat that's encasing your entire body. So I hope you understand at this point, fascia is super, super important. And if it's not moving correctly, then it keeps everything else from moving correctly. So whatever it's covering, if it's covering a joint, if it's covering a muscle, if it's covering a ligament, if it's covering a tendon, then that tissue that's underneath it or encased in it is also not going to be able to move correctly. And what we always say around here is that movement is life. Every tissue in your body is designed to be able to heal itself as long as it's moving correctly. So if this fascia is not moving correctly and it's not letting the structures underneath it move correctly, well, you can see how you're going to get into a real pickle. Now, the other thing that's very, very challenging about fascia is that there's not great blood flow to it. So yes, you have good blood flow to the muscles that are underneath the fascia, but the fascia itself is encasing the blood vessels. There's just not really great blood flow to it. So it can be really hard once you get an injury, a fascial injury particularly, it can be really hard for it to heal. That's why some people will do foam rolling and they'll try to increase the blood flow to that fascia on the side of the hip to get it to stretch out. Now, foam rolling is not my favorite thing to do if you have an iliotibial band syndrome or a tight iliotibial band. I prefer to work on strengthening the gluteus medius, which is the muscle that the IT band attaches into, because if you strengthen that muscle, it naturally takes stress off of the iliotibial band. By taking stress off the iliotibial band, it will naturally decrease the tension in it and return it to more of a normal tension. Now, if you really enjoy the pain of foam rolling your iliotibial band, then you go. I have no problem with that. But if you really want to solve this problem in the long term, you want to be strengthening your gluteus medius, because that's what's going to decrease the stress on that iliotibial band. All right, so fascia is literally tip of your head to tip of your toes. It's throughout your entire body. Now, many, many doctors and others in the medical community will tell you that the fascia cannot be your problem. I would respectfully disagree. If you have fascia literally everywhere in your body, how could it not be a problem? If you have a scar on your skin, that is going to affect how the skin is moving and may cause problems in the joints and muscles surrounding it, right? Why can't the same be true for fascia? And what I find with many, many of my patients is that they get these fascial adhesions, things really lock down, and that joint, muscle, ligament, tendon is not able to move correctly. And let's talk about the discs in your low back. There's tons of fascia surrounding your spine and the muscles that are surrounding your spine. These areas of fascia in particular can get really, really sticky if the spine's not moving correctly, because fascia, just like every other tissue in your body, needs to move correctly in order to have the proper lines of stress to keep it healthy. So if your low back stops moving correctly, no matter what direction that is, it's going to cause an abnormal stress to the fascia, which can cause it to get swollen or inflamed. And we already talked about how the fascia is like a shrinky dink and it's just going to adhere down. So what can you do about fascia? There's a lot of different techniques that you can use at home. You may have heard of the fascial blaster. That was big recently, and that people were, blasting away their fascia and creating all kinds of great things. I can't tell you. I don't know. It worked for some people. I definitely heard about some people who found it to be very helpful. And if you have found a technique like that that's been helpful, please drop it below, because definitely want to share different ideas on what has worked for you. What I find in my practice is that people need help releasing their fascia. They need hands-on treatment to be able to get that fascia to move correctly, to heal completely, as well as release the tissues that are underneath. So release the muscles, tendons, joints, all of those things so that they can move normally, so that they can heal. Most often people do not come to me because they have a fascial problem or know that they have a fascial problem. It's something that we find during the evaluation, and we need to treat it in order for that person to get full healing that they're looking for and getting back to the things that they love to do. So how do you know if the fascia is affecting you? Well, you may have a fascial problem if you notice a generalized achiness, or if you notice things traveling in a pattern that's not necessarily a muscle. Many people who come in who are suffering with fascial pain, whether or not they know it, it's pain that's traveling down the back of their leg, or the front of their leg, or the side of their leg, or all the way down their arm, front, back, whatever. That's often what people complain about, is a generalized achiness. It doesn't feel like it's just a muscle. It doesn't feel sharp like a nerve. So with like the back of the leg, if it's a sciatic nerve, usually it's sharp, it's hot, it's stabbing, but this is different. This is a generalized achiness that's going down the back of your leg, as opposed to the sciatic, which is going to be that really, really sharp pain going down the back of your leg. But if you have pain and you're wondering, is my pain fascial or is it something else? What you really need is to see a manual physical therapist and get a diagnosis that's specific to you. You need to have someone help you be able to release that fascia so that all of the tissues in your body can move normally. I hope this has been helpful. If you have a tool that's been helpful when you're dealing with your fascial issues, definitely drop it below, because I would love to provide that information for the rest of the community. And if you're looking for someone to help with your fascial issues, definitely give us a call. We would love to see if we're a good fit for what you're looking for. And as always, please hit subscribe or watch this video over here. Have a great day, everyone. Bye.